chest X-ray to generate the reports. I've chosen the chest X-ray of a patient. I'm going to click generate report, confirm that, and within a few seconds it has generated the findings and impression for the respective scan I fed into the system. You can pause the video and read the findings. If you're an expert radiologist, you can go through the findings along with the chest X-ray to to match up the accuracy or to evaluate the accuracy. Now we are going to do the same thing, but for the chest CT scan. So I'm going to upload chest CT scan of patient. These are some of the scans. These are scans of one particular patient. So I'm going to upload that scan. I'm going to hit generate report, confirm that, and within a few seconds I should see the findings and the impression for the respective CT scan I fed into the system. And I can also visualize the same CT scan on my browser and also evaluate the findings and how accurate they are with respect to the CT scan I fed into it. If you want to evaluate or validate the findings and impression it has generated, you can pause the video and you can have a look at it. So I'm going to slide the CT scan window for you to evaluate that or validate it. Subtle ground glass opacities are noted in the superior segment of the bilateral lower lobes. Considering RTA, the opacities are likely seen due to aspiration pneumonitis. However, the possibility of underlying infectious cause cannot be ruled out. There are atelectatic bands noted in the dependent portions of the bilateral lower lobes, minimal pleural effusion noted in the right lower zone. Cardiomegaly is noted. The trachea and esophagus are normal. ET tube and feeding tube in situ. There is no evidence of any mass lesion in the lungs. Mediastinum appears normal. Visualized sections, liver, spleen, pancreas, and adrenals are normal. See, and before I click on generate impressions, I have to do a couple of things. One of those things is to punctuate and do some necessary spell checks before I proceed further. So I'm just going to make those changes real quick. And it is also important to punctuate the findings properly for better results. And now the findings are ready to be generated. The impressions can be generated from these findings now. And before I click on generate impression, I need to choose in how many sentences do I expect to generate those impressions. So for now, I'm going to choose 3 sentences, enough for the findings represented in front of me. So I'm going to click Generate Impressions. And it says a note, it is highly recommended to properly punctuate findings in order to get most accurate. If you have already done that, necessary punctuations, then ignore this message and click Generate Impressions. So I've done that, so I'm going to ignore and click Generate Impressions. And here I have impressions generated with the report. We do have to do some minor changes like adding some spaces or having some enters in the findings for copy pasting this report exactly into your Word doc for the final, and the impressions are right in front of you. So the impressions goes like subtle ground glass opacity is noted in the superior segment of the bilateral lower lobes. Considering RTA, opacities are due to aspiration pneumonitis. However, the possibility of underlying infectious cause cannot be ruled out, and so on and so forth. It has given me 3 to 4 lines of impressions, which is approximately half of the findings which was given to the system as an input. Now if I want to